Tongaat Hulett is the latest South African company to be embroiled in a corruption scandal after the company produced financial statements that overstated its profits. What was done means that companies such as Tongaat are publicly admitting to unethical and dishonest behavior. What does it then mean for their blue-collar employees? Joining us now in the studio to discuss this is the Programs Manager for Healthy Living Alliances, Lawrence Mbalati. Lawrence, good to have you.
Good afternoon, and good afternoon to the viewers.
I mean, quite honestly, this is Hulett publicly, Tongaat Hulett publicly admitting to unethical behavior and dishonest behavior. What does it mean?
It means a lot. When we were campaigning, civil society was campaigning for the introduction of sugary drinks tax. The companies, the whole beverage industry and the sugar industry were up in arms. We know that in South Africa we have a growing and imploding obesity and non-communicable disease epidemic. Yeah. So they were up in arms that this will impact a lot in terms of job losses. As a result, it almost holds government at ransom not to implement the levy, yeah, which was introduced in April last year to 2018. So it's a bizarre scandal, and it's an irony looking at already the company has served employees with a notice for retrenchments. Yeah. And it has been siding a lot in terms of the levy or the sugar drinks tax that it has impacted on its production and its revenue.
So in simple terms, what does this mean? They're understating their profits. I mean, we know that the sugar industry is in a crisis at this particular point. They are not doing so well, but of course they've been overstating this not doing well.
I mean, the principle of our constitution is transparency, it's accountability, it's the rule of law. If we don't know, if the executive, if the bosses are swimming in the pool of lies, yeah, and they cannot be transparent about their financial statements, and what it impacts on the bottom line for employees and their families. They are facing the burden of issues of bread and butter in the table. It's a serious matter. And on the other hand, we know that they have not been truthful. They have been getting bonuses. They have been coming out attacking, putting the lives of South Africans first and ensuring that we can have a healthy nation by reducing sugar into drinks and the food that we eat.
What does this mean then for the jobs? You already mentioned that they were already beginning to retrench.
It's a serious concern. We know the issue of the jobs. The jobs are not just for me and you. It's our families, it's our communities, it's the economy as a whole. So this will have a serious impact, but I think, as we have said, we have openly said so, that everyone who have been embroiled in this scandal must face music. They must actually pay back the money, and we want to hear that employees are reinstated, want to hear that employees actually have been put first, and there are negotiations that are progressive with government and labor to ensure that there are not jobs that are lost because we don't know what actually is going on there. Yeah. We have been waiting impatiently in terms of the NEDLEC report, in terms of the jobs that the industry has been threatening communities and the employees with in terms of job losses. And we face now with this huge scandal. I think, after the scandal that we have been having. And I think what we are calling for is accountability, right, is to ensure that the corporate, equally so as we have hold the public sector, you know, the SOEs, the corporate sector must stop with the greed and pushing the profit margin at the expense of employees and the communities where they operate.
From the Healthy Living Alliance, I mean, what is your view on the tax? Because they've, of course, been crying foul over this tax. Do you think then government can afford to put a little bit more on the tax, particularly to deal with the issues of communicable diseases?
Definitely. We know that the best practice of implementing the tax is to get to 20%. If you want to see significant cap and reduction in consumption. Currently, government has introduced 11%, which is still having a deficit if I exclude inflation-based increases.
Yeah.
So we're at 11%. We need to get to 20% to meaningfully reduce the consumption of high sugar level drinks and food, and to ensure that we can actually reduce obesity, which is a huge epidemic.
But then what do you say
Africa.
to the reports that say the tax levy has not changed the behavior of consumers? In fact, consumers have just kind of carried on as if there was no sugary tax.
We know that in the short term, right, the behavioral pattern obviously can impact on, you know, the people who are around the poverty or under the poverty line. But we know in the long term, remember this has just been implemented for just a period of 1 year and a month.
Right.
So in the long term, we know evidence, the World Health Organization has enough data that proves that in the long term, the consumption with an increase of sugar tax has a huge impact in terms of reducing the consumption and therefore reducing obesity and non-communicable disease. And we know currently, I mean, 51% of death in South Africa are occurring due to non-communicable diseases. Right. So the non-communicable diseases have grown significantly. It's actually imploding and impacting on the capacity of the health system to respond adequately.
As the Healthy Living Alliance, are you seeing the impact of this money? Because here's the criticism to this issue of tax, is that this tax money goes into a big pool. There is no ring fencing of this money to say, okay, it's ring fenced to actually deal with communicable diseases, to deal with issues of diabetes, to deal with those illnesses that are related to sugar. Are you happy with how the government has used the tax, even though marginal it is?
So we have been engaging the Department of Health, particularly on that aspect, because we are advocating exactly for ring fencing, ensuring that this money is allocated for health promotion, so that we ensure that we have a healthy nation. People are educated about, you know, what is in their food. People must understand, you know, what they are drinking, what we are consuming on a daily basis. We have a campaign that's talking about what is in my food campaign. So we are in the process. We have put together a recommendation, a proposal to the Department of Health on what should be the key priorities on health promotion, on educating public, on ensuring that this money is spent and is allocated, this revenue is allocated exactly to actually reduce, to prevent and manage the non-communicable disease and obesity in South Africa.
What should be those key priorities?
So the key priorities range from ensuring that we promote healthy living. We ensure that people understand, you know, what is in the food that they are eating.
Yeah.
We must ensure that government holistically prioritize small-scale farmers to ensure that actually small-scale farmers are being used in terms of the procurement processes to provide traditionally, you know, naturally produced healthy food in places like clinics, like hospitals, like prisons. We are also saying government must actually subsidize healthy food, yeah, in making sure that there are zero taxes so that at least poor people and working class people can have access to healthy food. So it ranges from a range of things that we are looking at. We can make sure that we put food security first. We can make sure that in schools, for example, we are pushing for guidelines to ensure that tech shops, there are tech shop guidelines. We're working with UNICEF and other civil society organizations to ensure that kids can have healthy food at schools, fresh, warm, healthy food at schools to prevent obesity.
How can this particular levy be used, for example, to stimulate economic growth, but not only that, but also to deal with matters of inequality and making sure that, I suppose, people are employed, people are introduced or put into the mainstream of the economy?
No, precisely. For one of the things that we're actually advocating for is to ensure that the implementation of the National Health Insurance, it's one of the ways that this money can actually be used to actually address or tackle inequality and ensure that there is equity in terms of accessible quality health, public health care services for the population or for all people living in South Africa.
Lawrence Mbalati, we appreciate your time. He is the Programs Manager from the Healthy Living Alliance. Of course, they are calling for the employers to pay back the money, saying that we are built on the Constitution, and the Constitution is built on transparency, and these corporates have not been behaving the way that they should be behaving, and therefore, just as we hold the public sector to account, they must also be held accountable on governance